So as you were just notified, this webinar is being recorded. I will share the link to the YouTube channel where you can find previously recorded Governor's Conference on Aging webinars, including this one, in just a few short days. I'm going to go ahead and share my screen to get us started. Alrighty, we are at 1 o'clock. So thank you everyone for joining. The Virginia Governor's Conference on Aging webinar series is generously sponsored by Virginia Housing. I will be sharing links to our website and, as I mentioned, the YouTube channel and other helpful items in the chat box shortly. We really encourage questions. Please submit your questions through the Q&A box to help our speakers keep track of all inquiries. There will be times, however, when the speakers prompt you to engage and pose questions to you. So in those instances, feel free to use the chat box to let us know your thoughts or other things that the speakers may ask. So I'm really pleased that Carol Paquette and Mary Jane Atwater are joining us today to present Villages, Aging in Place with Choices and Connections. I'm going to go ahead and stop sharing the screen, my screen, and hand it over to our speakers while I introduce them a little bit further. Alrighty, Carol Paquette is a former board member and past president of the Village to Village Network, the national association that provides expert guidance and resources to support villages. She was a co-founder and the first president of Arlington Neighborhood Village in Arlington, Virginia, where she resides. She was part of the VTVN research team that explored collaborations between villages and area agencies on aging in 2022. She currently serves as the Governor of the Virginia Villages Collective, an informal group advocating for the growth of villages in Virginia. Carol received a BA in political science from West Virginia University and a JD from Georgetown University Law Center. Mary Jane Atwater is a board member of the Village to Village Network and a co-founder and past board chair of Lake of the Woods Living Independently in Our Community, a village in Orange County, Virginia. In 2022, she was a member of the VTVN research team that studied village collaborations with area agencies on aging, and she is currently a member of the Virginia Villages Collective. Before retiring, Mary Jane was a public relations and marketing communications executive. Mary Jane received her BA in history from Connecticut College and holds an MA in education and an MBA degrees from the George Washington University. So we're really grateful for their participation in our series. And I think this webinar will be very informative and insightful. So thank you everyone for joining. Again, keep your eyes peeled on the chat box. I'll be sharing some helpful links to the YouTube, to our website, and we will touch base after the webinar. Thank you, everyone.
Well, good afternoon, everyone. We really appreciate all of you joining us to hear about villages. We always like to start out these presentations by asking the audience who is familiar with the village model. And as Jillian mentioned earlier, if you would please just say yes or no in the chat, we'll be very interested in finding out about that. The next slide, please, Mary Jane.
Whoops. Well, I am having trouble advancing my slides, Carol. There we go.
Let me just tell you a little bit about the Virginia Villages Collective. We are an informal group comprised of the 16 villages in Virginia. Our purpose is to enable more older Virginians to safely age in place and to live their best possible lives. And we're trying to do that by increasing awareness of the benefits of the village model, promoting the development of new villages, and to foster the growth of existing villages in Virginia. And we also want to grow partnerships with other organizations in the aging network that are serving older Virginians and their care workers. So we hope to be collaborating with many of you in the audience today at some point. Mary Jane, next slide, please. This just gives you a quick overview of where the villages are in Virginia. Heavy concentration in Northern Virginia, which you might suspect given the population distribution in the state. But we do have a number of villages in other locations and quite a few rural villages in Virginia. Next slide, please. The purpose of our briefing today is to talk about the village model and how the villages in Virginia are currently assisting our older residents to age in place. We're going to talk about some strategies that we're proposing to expand villages in the state. And we'd like to identify some partners that might be interested in working with us on village formation and capacity building. I'm now going to turn it over to Mary Jane to talk a little bit about the village model and what villages do.
Great. So yes, I'm going to talk about villages, what the model is and what it isn't. Also about the role of villages in Virginia and in the Aging Services Network here. So exactly what is a village? When we talk about working with villages, often people say, oh, you mean that community in Florida, retirement community where people drive around in golf carts. Well, that's not what we are at all. Rather, we are a community-based grassroots membership organization, or villages are grassroots membership organizations that operate on the principle of neighbors helping neighbors. And as Carol suggested earlier, the mission of villages is to enable older adults to remain in their homes safely, independently, and with choices in how they live their lives and connections to the community. So we all know that there are many transitions in aging, and villages provide support during those transitions, those ups and downs during the aging journey. And villages offer activities to reduce social isolation. We all know about the risks of social isolation, and they deliver support services when needed. And I'll talk in a few moments about what those support services are. It's important to recognize that villages, again, they're not brick and mortar buildings, but they are powered by volunteers. The volunteers serve on the board, they direct the committees, they manage operations, they plan and operate or implement the programs, and they deliver the services. So how are villages organized? Well, it's important to recognize that villages respond to the needs of older adults in the community. They're really based on what older adults in any particular community need. And for that reason, each village is going to be a little bit different. And there's a saying, if you've seen one village, you've seen one village. So villages have a variety of business models. Some of them are neighborhood networks. Those are kind of loosely organized neighbors who come together. Maybe they're direct, or they have a steering committee, and they have a defined area where the neighbors are helping neighbors. No strict business organization there. Villages are also standalone nonprofits. And of the 16 villages in Virginia, 13 are standalone nonprofits. These are villages that have incorporated in the state. They most have a 501c3 designation by the IRS. They have bylaws, they have a board of directors, so they have a business structure. And then there are sponsored villages. These are villages that might be sponsored by a nonprofit organization, a faith-based community, for example, maybe even an HOA. They could be sponsored by a government agency, such as a AAA. They might be sponsored by a healthcare entity. And then we have the hub and spoke model. The hub and spoke model, we have a let me back up for 1 second and say, of the 16 villages in Virginia, 3 are sponsored villages. The hub and spoke model, for that model, there's a centralized village that has the administrative functions, the operational, maybe fundraising functions for a number of spoke villages, smaller villages, usually in that region. So those are the variety of business models. Most villages charge a moderate fee to support operations. In my own village, Low Link charges $400 for an individual per year and $500 for a couple or a household. And most villages will discount the membership fee for lower income individuals, those with demonstrated need. The membership fees do provide some funding for villages. Many rely also on grants and donations, and some are reimbursed for the services they provide by, say, a sponsored entity, a partner organization. And as we mentioned before, villages are primarily run by volunteers. Some may have a small paid staff. My own village has an executive director who is full-time, and then 2 part-time administrative people. Many of the village members also serve as volunteers. In my village, we have members who answer the phones, who provide some administrative work. Some of them even drive other members to their appointments as volunteers. And villages collaborate extensively with other community groups and service providers. You find that villages might partner with a local educational institution, even a high school, a college. They partner with their AAA, other aging service providers. In my own village, we have a partnership with the University of Mary Washington, and their honors students come and provide tech support for our members. And villages are the entry level in the continuum of care. They're there for people who need just a little help to stay in their homes. So examples of village services, transportation is for most villages a key service that they provide. And during COVID, transportation was very important. People, our members, needed to get to really critical medical care appointments, such as oncology appointments or dialysis. And the villages definitely were able to excel during that time and have continued to do so. To medical appointments, grocery shopping, errands. And we all know that if you have a house, a condo, an apartment, that there's some home maintenance that has to be done on a regular basis, changing light bulbs, smoke detector batteries, that kind of thing. And village volunteers provide those services. They'll also do occasional yard work, maybe sweep off the steps or clear off the steps after a snowfall for safety purposes. Village volunteers do occasional pet care. If somebody's coming home from the hospital, can't walk the dog for a couple weeks. Work on downsizing and organizing, helping our members live more comfortably in their homes. Tech support is very important as more and more older adults become adept at using computers and tablets and smartphones. They need support. They like to have support. They want to learn new ways to use that smartphone. And so tech support is an important service that most villages provide. And heavy lifting is here, moving some furniture around or maybe flipping the mattress, that kind of thing. Wellness support is key. And again, this was very important during COVID. Many villages implemented kind of a buddy system where they'd have a volunteer calling a member, just a kind of friendly, how are you, and a way to chat. Caregiver respite is important. Meal delivery, certainly post-discharge from the hospital, meal delivery is a service that villages provide. Prescription pickup, walking groups are quite popular. So let's talk about socialization, because that is, of course, important for villages and important for all older adults. We know about the Surgeon General's advisory, our epidemic of loneliness and isolation. And so villages are key in implementing social activities. that keep people engaged. Educational programs, falls prevention programs. Village volunteers take members on museum visits. They go to concerts, to movies. There are exercise classes, that kind of thing. Meals, we all love to eat, and so dining around is very popular. And volunteering opportunities. And I think this is really key for both the volunteers and for the members. I know when I drive somebody to their doctor's appointment, and it's a 25-minute drive for us here in Orange County, Virginia. And it's a great opportunity for me to get to know the member, for the member to get to know me. There's lots of sharing of stories, and it's really a socialization opportunity, not only for the volunteer, but for the member. So let's talk about why villages are important now. I know you aren't surprised to know that most adults do prefer to age in place. There's data to show it. AARP did a home and community preferences survey that said that 77% of those over 50 wanted to remain in their homes as they aged. And this is true across the board, these figures. Living in one's home is certainly the most available and affordable option for most older adults. And when you think about it, most older adults are able to remain in their homes with just a little unskilled help, the kind of things that we talked about, little home maintenance, transportation, some errands, that kind of thing. We do know certainly that some older adults need professional services and skilled assistance. And when that happens, that can often be paired with a little unskilled help, somebody to still, even if they have home care, someone else to manage some of the other unskilled needs, helping needs that people have. And as we've mentioned, all older adults need opportunities to socialize, to have purpose in life, to get up in the morning and know that you have something to do. So let's talk a little bit about the need for aging services, and particularly in Virginia. So in 2021, the Joint Commission on Healthcare did a study, the strategies to support aging Virginians and their communities. And I don't think the results will surprise you too much. Currently, there are 200,000 older Virginians who need services, and that number is expected to rise significantly by 2030, so only 7 years from now. Only 12% of those who need services are eligible for Medicaid services and supports. And non-Medicaid funding has decreased by 14% in the last 10 years. So what that means is that there are a significant number of older Virginians who are kind of in the middle there, who don't qualify for Medicaid, but who also don't have the resources for the more expensive options, such as long-term care, or life care, I should say, options, home care. So demand for assistance from the most vulnerable priority populations often exceeds the service capacity of the area agencies on aging, and there are long waiting lists, and there's significant disparity of access to services in the Commonwealth. So Virginia villages are kind of stepping in to address this need. And as we've mentioned, there are 16 villages. We've put together some data here about the level of service that villages are providing in Virginia. They're providing unskilled assistance 32,500 hours last year. And there were 1,100 volunteers, 2,200 members. And when you take the value of those service hours, if you use the figure provided by the independent sector, which values volunteer hours in Virginia at about $32, the total value of those volunteer hours is over $1 million. And as we've said, villages provide opportunities for socialization, engagement, personal interest. So the Virginia villages last year provided 1,400 social events, educational programs, and many of those are open to the entire community. I know in our village, when we have a speaker series, we do open it to everyone at Lake of the Woods. Villages here in Virginia are delaying and reducing the need for professional assistance, and they're supplementing and complementing the services and programs from area agencies on aging and other community-based organizations. They're extending the capacity to serve more older Virginians. In my village, we partner with now Encompass, it's called RAAA, to provide transportation in the eastern end of Orange County. So we're expanding the capacity of RAAA to do that work. Okay, now I'll turn it back to Carol.
And Mary Jane, if you would just leave that last slide up for a moment, this is when
Sure.
I'm going to ask my second question. As you indicated, your village and many of the villages in Virginia work with AAAs and other organizations. So again, I wanted to ask our participants if you might be collaborating in some way with the village, and if you could tell us, what that collaboration is all about. And again, if you would put that in the chat, we would appreciate it. We did this at a conference a few weeks ago, and we got some really interesting responses about things that people are doing with villages. So we'd like to hear from you as well. So while they're doing that, we can move on to the next slide, please.
I am trying, Carol, here. There we go.
So one of the things that the Virginia Villages Collective focused on, and really it was the event that caused us to get together and start taking action, was the update of the Virginia State Plan for Aging Services that was taking place in this past year. So we decided to get all the villages in Virginia involved to have the villages have a voice in the state planning process. And as a result, we actually did get villages into the state plan. And what you're looking at on this slide is, where that is. So the state plan is organized by goals and objectives. And under the goal number 4, to bolster awareness and increase access to person-centered services and supports, one of the strategies there is to share information about villages, which facilitate and support aging in place and in the community, in all the ways that Mary Jane has just talked about in terms of programs and services and socialization. So we were very pleased to be able to at least get a mention of villages in the state plan. So as a result of that, we are continuing to take action. And if we could have the next slide. So that strategy was to share information. So we've been very busy educating various organizations around the state about villages, doing webinars like this and making other types of presentations. So this just lets you know some of the organizations that we have already spoken to, and I think in the next presentation we'll be adding the Virginia Governor's Council on Aging, a Conference on Aging logo as another outreach effort. So we are trying to get the word out because as we see in the chat today, there are a lot of people that really are not very familiar with villages. So we're trying to get the concept, get the model more familiar to people, and let them know what villages are about. And the next slide. And then we also would like to have some further action. In 2021, the Joint Commission on Healthcare recommended a grant program to develop and expand community-based organizations such as villages. That recommendation did not get accepted by the legislature, but we sort of re-energized that recommendation in 2023 to have a pilot program that would expand and support villages around the state, working together with AAAs and other organizations. So what we see as the 2 objectives of a pilot program, would be to support the formation of new villages and to build the capacity of existing villages. Now, we've had some conversations with several members of the General Assembly who have been, I would say, fairly responsive to this idea. Of course, I know we have many people on the call, or some people on the call, who are not from Virginia. But for those of you who are in Virginia, you know that we're going to have a big change in our General Assembly this year. All the seats are up for re-election right now. And we have a number of members who have retired, and we've had redistricting and a lot of stuff going on in Virginia. So the General Assembly will probably look a good bit different in 2024 than it has in this year. But we are hoping to promote this program, and we will just see what happens. So the next slide, please. So we're taking a particular approach in the formation of new villages. The data that we have from villages that have formed around the country is that when a village planning group gets associated with an already established organization, it takes much less time and effort and expense to get a village started. So why is this? So one of the first things you have to do as a village, I think it came across in Mary Jane's comments, a village is really a small business. So as she said, most villages are incorporated. They're incorporated as nonprofits. So you have to set up a whole business structure, and you have to have procedures, and you have to have boards of directors and forms and information systems and communication systems. And most people that want to start a village, they start from the premise that they really, as I did in Arlington when I was helping to form the village here, say, I've lived in Arlington most of my life. I've raised my family here. I have no intention of leaving Arlington when I retire, and I would like to continue staying here. I'm going to need some help. I can't lift those 40-pound bags of garden mulch anymore. So there are other things I need help with, and I recognize that, my friends and colleagues and neighbors also need some help. So we got a bunch of us together to say, let's figure out how we can help each other. And we'd heard about the village model. So we were motivated by saying, hey, we want to help each other and figure out how to do this. Well, then as we started to get into it, we said, oh, wow, we have to incorporate, we have to do all this business stuff. And there were several people on the planning team that said, hey, I've done that for my life, my career. I really don't want to do that anymore. So let me know when you get started and get all that administrative stuff out of the way. And I'll be happy to come and actually do the work of the village. So when a village gets associated with a village planning group that's associated with an already established organization, a lot of that infrastructure is already in place. There's an organization, there are procedures. You will need, procedures specific to the village, but you can really concentrate, the village planners can really concentrate on the things that are necessary for a village. That is, getting the word out about what the village does, recruiting members, recruiting volunteers, establishing your programs and services, all those things, which is what we all really love and enjoy about villages, and then depend on the sponsoring organization to provide a lot of that back office administrative support that you don't then have to set up as a separate organization. So we have examples. We have, 6 categories here. We have examples around the country of villages that have been started in association with all these various types of organizations. And there are lots of ways of sponsoring a village. So the simplest relationship is something called a fiscal sponsorship. And that is simply where another nonprofit, which already has a 501c3 and has a closely related similar mission to what villages do, They allow the village to utilize their 501c3 status to help raise money, and help to provide some of the financial management for the village. We have some other things that are called incubator sponsorships, where a sponsoring organization will start a village with the express intention of saying, hey, we'll help you get up and get started as a village. But we all understand that, when you get established and you're on your feet, maybe in 2 or 3 years, the village will then spin off and become its own independent entity. Then we have another relationship where the village doesn't spin off and they remain, under the sponsorship of a parent organization. And we have quite a number of examples of, those sorts of sponsored villages. And then there's a variety of village that Mary Jane referenced called a hub and spoke village. And I think she already explained what this is, where in this case, there's a hub village that takes on the job of doing all the business process and the administrative infrastructure, and gets all that established. And then there are spoke villages that are associated with that hub, and those villages then can focus on the activities of being a village and running village programs. And we have quite a number of hub and spoke arrangements around the country as well. I think we're ready for the next slide. So I think you can probably understand starting new villages, that's providing more opportunities around the state for older adults to participate in villages. But we're also interested in building the capacity of existing villages. Our existing villages are continuing to expand to reach out to underserved communities. As I mentioned, we have quite a few villages that are in rural areas, and they are taking on fairly significant roles in helping the older adults in their communities to have some options and choices. And so existing villages need relationships with other organizations to help them do this expansion. And sort of vice versa, they also help other organizations, as Mary Jane mentioned, the AAA in Lowlink's case, where they are helping the AAA, the village is helping the AAA, or they're helping each other really to expand the access to transportation for the older adults in Orange County. The village movement has been around for about 20 years. So we're finding that many people who join villages are getting older. And, in some cases, getting older leads to diminished capabilities and frail health. And villages are increasingly finding that they need to have additional capability to assist their members that have become frail as they've aged, and also to reach out to members who might be having a health crisis of some kind. So there are a number of villages. My village in Arlington, for example, we have a contract healthcare provider. Planner. When we have a member who's having a health crisis or who needs more assistance than the village can provide, we can have that consultant come in and work on a plan to help that member find additional resources and address, whatever their particular issues are. So there are a number of villages that are expanding their capability in this way to respond to the needs of their members. And then village operations require information systems. We need to track members and volunteers. Most villages vet their volunteers, so you have to maintain that information about your volunteer vetting. For volunteers that drive, they get vetted, and their insurance and their driver's license information is verified, so that the village knows that the person is qualified to be a safe driver. So there's a lot of data collection and management, tracking service requests, and who is fulfilling them, and what happened as a result of that request, and programs that are being sponsored, and how many people have attended, and all the material associated with developing programs. So again, existing villages, as they grow and expand their programs, they see continuing challenges in developing the technology that they need to help them do their job. Next chart, please. So why are we proposing a pilot program? Well, for one reason is we can target underserved communities. So what we're thinking is that we will work with AAAs and other organizations that are plugged into the need, more than plugged into the need. As many of you are probably aware, the AAAs all do an area plan where they address the needs in their service areas. So we see these plans as a basic information source for identifying where there might be a big need for having a village get started. So we hope to be able to place villages in places of greatest need. A pilot program is small, and it's a limited time period, so it doesn't involve a lot of financial resources, and it's relatively low risk. And because it's limited time, and we're looking at maybe a 2-year time frame, you'll have quick results. So you have an idea of, is this working? What is working? What's not working in terms of what we're trying to do? And then any pilot would also have a formal evaluation process that would capture all the data about the pilot, and how well it worked and what might not have worked. And that can be input for planning in the future. Next slide. Excuse me one moment. From the research project that Mary Jane and I both worked on for the Village to Village Network in 2022, we discovered that there are quite a number of other states that are supporting village development and the expansion of existing villages. And I'm not going to read through this whole list, but you can see it's pretty dispersed around the country. And I just pulled out one because the Maryland Department of Aging just recently, I think maybe about 3 weeks ago, issued RFPs specifically for starting villages and providing technical support for groups that want to start villages. So we're going to be looking at, what happens in Maryland, and what they're learning, and hopefully apply some of those lessons in Virginia. Next slide. So there are some barriers, as I mentioned, and as many of you affirmed in your comments in the chat. The village model is not very well known. So, when you start to talk to someone about a village, you almost always have to start with a disclaimer that Mary Jane used to say, we're not talking about a brick and mortar kind of development. It's not a retirement community. It's a virtual community where people are living in their own homes. There's also a lot of misinformation and stereotypes about villages. Villages got started largely in white middle class neighborhoods, and most of the villages today are still in white middle class neighborhoods. So there are people that think, hey, this is just for that particular segment of the population. It's really not for me. But villages have been working very hard to, as I mentioned, expand into underserved areas, to expand the diversity of their membership and their volunteer base. And they are, being fairly successful in those regards. So we want to get people disabused of the idea of, oh, this is just another white middle class thing. and because we believe that it really has value and applicability for all older adults. Another big barrier is the organizing of an effective startup team. So as I mentioned, when you're starting a village, you're really starting a small business. So you need some people on your team who are able to deal with the issues relative to starting a small business, incorporation, doing a business plan, doing a market survey. And as I mentioned, in my own case in Arlington, there were some people on the startup team who just said, hey, I'm not interested in the business planning part of this. I just want to be part of the neighbor helping neighbor part. So call me when you're ready for me to do that. And then funding. Villages, it costs about $10,000 for an independent standalone village. It costs about $10,000 to get started. And people say, well, if you're basically run by volunteers, what do you use all that money for? Well, there's all the incorporation and the filing with the state and localities, getting an IT system. As I mentioned, most villages vet their volunteers, and there's an expense associated with that. Insurance is another big factor for villages, both for their directors and officers insurance, as well as general liability insurance to cover the organization and volunteers. So while probably 95% of what goes on in a village is done for free by volunteers, there's still some significant costs associated with running a village. And the next slide. So here's our challenge to you. We are looking for people that are interested in building community to collaborate with existing villages. And we did have that map that gave you a very general idea of where existing villages are, but we can tell you exactly where they are if you want to contact us. And we're also interested in organizations or individuals that are interested in starting new villages. We think Mary Jane and I have both been involved with the villages for, I guess, around 10 years. We're here today. We both volunteer enormous amounts of our time, spend our own money to go to conferences and do different things because we think villages is a really great thing for older adults. I really feel good about being a member of my village and volunteering for my village. And, we just hear that from village members and volunteers everywhere, that it's just a great experience. So we're inviting you to join us and extend this experience to more people. So please feel free to contact either myself or Mary Jane, and we'll be happy to work with you. So I think we will now, if anyone has any questions or discussion points, as Jillian mentioned, if you could put those in the Q&A section on your screen, we'll be very happy to address any questions that you have.
And before you hit the ones over in the Q&A feature, there are some from earlier on in the chat box inquiring any suggestions on how to approach a sponsor.
Yes. I'm just trying to skim through the chat to see it. I'm not, oh, there it is right there. Well, it really depends on what sponsor. So this is from Jasmine. So Jasmine, if are you with a village? If you are with a village or a village planning group, you need to identify who are potential sponsors in your community. So as I think we mentioned in one of the slides, the AAA is one possibility. Senior centers are a possibility. A faith-based organization. There might be a healthcare organization or a local hospital that might be interested in helping to support a village. So it's like many things about villages, there's not a simple answer to the question. It really requires a bit of a discussion. One of the things we didn't really talk about very much about starting a village is we strongly recommend doing both a resource assessment and a needs assessment in your community. So the resource assessment is looking at all the organizations, whether they be government agencies or nonprofits, faith-based groups that are already working in the arena of supporting older adults in some way. So one of the things that we discover when, I'll speak to my personal experience, when I was making presentations to various community groups about starting the village in Arlington, there would be people saying, well, we have the Shepherd Center. They already do transportation. Or, we have this organization or that organization. They're already doing this. Why do we need another organization? So it's very important for you to understand who the service providers are already in your community, because villages really, we don't want to duplicate what other people are doing, but we try to fill some of the gaps and work to complement what other organizations are doing. Now, I think any of you that are working in the aging services realm know that there can never be enough transportation providers. So the fact that there may be a Shepherd Center or there may be some other organization providing rides, the demand just far outstrips the supply. It is the most heavily utilized service from villages all around the country. So that's the resource assessment. And that's also important to not just find out who is in your community, but to become known to them. Let them know that you're interested in starting a village, and how you might work with them to make that happen. Then on the needs assessment, you need to find out, so are the people in your community interested in a village? So once again, you face this issue that many people are really not terribly familiar with what a village is. So you have to explain, what a village is, why they might be interested, what's in it for them, what they might do to help the village, what the village might do to help them. So you have to, get the word out, and again, do a lot of contacting. There are a number of needs assessment questionnaires surveys that different villages have developed that you can get access to sort of give you an idea of, the kinds of questions to ask. And then you have to pull all that information together and say, hey, it looks like there's only 10 people in this, let's say, 10 block area, if you're looking at a suburban or urban arena, that are even interested in the village. So maybe this is not a good idea at this point in time. So you really have to, again, this is part of the idea of, it's sort of like setting up a business. So if you want to start a business in your neighborhood, you really need to find out, so who are your competitors? And what, is there a need? Is there an interest in having, yet another provider in your arena? So this has been a very long-winded answer, but as I said, there's not a simple 1, 2, 3 step response.
One thing I could add to Carol's response here, one of the things that we did to generate interest in the village was, we also, in addition to our needs assessment, at the same time we were doing that, we held a series of focus groups in our community, and we just gathered some community leaders, We opened it up. We said, would you like to come? And we had some very good discussions where we were able to explain the village model, talk about what we might be able to do in our community, and really obtain some input about what the needs in the community were. So that was important. And people shy away from the word discussion group, a focus group, so we call them discussion groups. And we had no trouble getting people to come and talk with us. So I wanted to add that as another mechanism for assessing the needs in your community.
And I see another comment in the chat about volunteers and how important volunteers are.
That's a good one.
We can't have villages without volunteers. Just doesn't happen. And there was a question about showing volunteer appreciation and providing incentives to get and keep volunteers. This is I think, an issue of importance to probably every nonprofit organization working with older adults, recruiting and maintaining your volunteers. In Arlington, we make a big deal about our volunteers. We have volunteer appreciation days. We have volunteer awards for people that have driven the most miles or put in the most hours, or various other categories to really recognize what our volunteers are doing. And one of the things that we find that's important to keep volunteers is to keep them busy. We find that when we sign up a new, we really have a policy in Arlington of when we sign up a new volunteer, is try to give them a volunteer opportunity, whether that's providing a service or to work on a program or whatever it might be, to get a volunteering opportunity in front of them as quickly as possible. Because people volunteer because they want to do something. Having said that, I would say that I think all villages now have, we try to keep track of how many volunteers we have. That's an important number. We need to provide that information when we're making grant applications, for example. But I'm starting to see villages that are making the distinction to say, well, I have 200 volunteers on the books. But when it comes to active volunteers, that's something more like maybe 75. So I'm just using those numbers for talking purposes. But we do recognize, and it seems to be a common phenomenon, that many people volunteer and then they never accept a volunteer assignment. They never follow through. And I mean, there are many, many reasons for that, but we do make a big point of expressing appreciation for our volunteers every opportunity that we get. And we got a lot of feedback from our volunteers about how much they enjoy what they're doing. So there is, I think, as someone noted, there's value to the volunteer. It's not just value to the member. It's, villages are not transactional. Villages are all about building relationships. And that is, they engage everybody that gets involved in the village process. So it kind of gets a benefit for everyone.
Carol, there's a good question here about do you perform background checks and how do you vet them for the safety of participants? And I know that we all do that. I mean, all of the villages do vet the volunteers, and there are some commercial services out there that are fairly low cost that will vet them against national databases, and also will vet their driving record. Sometimes I think the one that we use, it's $35 per applicant. And then we give the volunteer an opportunity to pay for that application as well. And most times they do. So, and we also have a good bit of volunteer training that goes on, not only the orientation when we first take on a volunteer, but also ongoing training. How do you help somebody with mobility issues? what do you do if somebody does fall? So, all of that kind of work is done with our volunteers. And I think the volunteer education is really a benefit of volunteering and helps keep volunteers engaged and engaged with us. Carol, do you have anything on that one?
No, I think that's a good response. And
Yeah, somebody Marianne Long just said you can use checker.com, $45 for a criminal background check and driving.
yeah, there's also, in addition to the criminal background check and the driving, there's also the sex offender list, whatever that's called. That's another check
Right.
that needs to be done. Older adults are considered to be a vulnerable population. And so when you have volunteers working with a vulnerable population, so older adults and children, there are certain requirements that I don't know if there's state level requirements. We set up our volunteer vetting program under the guidance of the Parks and Rec department in Arlington. And so we used the same criteria that they did for vetting the volunteers that work with the kids in Parks and Rec.
I see
There was a question about can we give the names of all the villages? It's on one of our briefing charts, and rather than read all those names, I think these briefing charts will be available to you in the recording. Is that right, Jillian?
Yes, and in a follow-up email, there will also be the presentation slide decks. So you'll have it in the recording, and you'll actually have the physical or the physical file, the file itself.
Yeah, it's on slide number 3. So all those locations, and each one of those villages has a website. So they're pretty easy to find. There's a question about, do you have to deal with liability concerns, and if so, how? Again, that's kind of an insurance question. And we are, as Carol said, villages have directors and D&O insurance for protecting the board, and they also have liability coverage. And we use an agent in Haymarket who I think it's a nonprofit insurance alliance, an agent for that particular broker, if I've got the terminology correct, and they do cover a number of villages.
Yes, that's an aspect that is also covered by many villages with their volunteer training. That we give our volunteers training on how to manage physical contact with members. So, for example, if a member needs assistance getting into the vehicle, you can assist someone to get into the vehicle, but in general, there is a no physical touching rule for volunteers. But there are those instances where you do need to provide assistance to someone. And so we try to train people about what those circumstances are and how to properly do that. We have a member who is blind. So we need to have volunteers who are comfortable with and know how to interact with a blind person. So that's all part of keeping our volunteers informed of things that they need to know in order to work with our members.
Carol, there's something in the chat about Good Samaritan insurance. I don't know. There's a Good Samaritan kind of law, isn't there? You may know more about it as a lawyer.
Most states have a Good Samaritan law, and there are. I've heard many people say, "Well, you don't need insurance because volunteers are helping people, so they're covered by Good Samaritan." Well, they're not. Good Samaritan laws, in general, they are restricted to emergency situations. So, if I come across an accident on the highway and I stop to help someone there, I'm not medically trained, but I will do, stop the bleeding or do whatever it is that I think is the best thing to do to help that injured person. that type of activity is covered by Good Samaritan. But our volunteers are not working in emergency situations. They are responding. We have a service request, so it's well known in advance. They're going to be doing something with Mary Jones, and it's not at all the type of situation that Good Samaritan laws are in place to cover. Any other questions? Have we missed anything here?
And while we wait for any final questions, I will just reiterate that we will be sending out a follow-up email to all attendees, which will include the presentation slide deck as mentioned, the link to the webinar recording, and our speakers' emails. If you have any questions you did not think of today, you can reach them that way. But it looks like we've had just a lot of positive feedback of how informative this webinar has been. So thank you so much, Mary Jane and Carol.
Our pleasure.
Thank you for the opportunity.
Yeah, we appreciate it.
I don't see any final questions. So I hope everyone enjoys the rest of their day. And thank you again very much for joining.
Thank you.
Bye. Thank you.